About 1 in 5 adults has a diagnosable mental disorder, and mental illnesses are more common than cancer, diabetes, or heart disease. Serious mental illness can disrupt a person's thinking, feeling, mood, ability to relate to others, and daily functioning. But it's important to know there is help. Catholic Health Services can assist individuals in recovery. Stay tuned to find out more about different disorders, the conditions sometimes related to mental illness, and how to manage the effects on today's episode of CHS Presents Lifestyles at the Heart of Health. Hello, everyone. Thanks so much for joining us. I'm Jane Hansen. If someone you love has mental illness, you know how it affects every aspect of life, and the challenges can be overwhelming to you and your family. But there's help for all of us. Joining us today to discuss this topic is Dr. David Flomenhaft, a licensed clinical social worker and director of outpatient behavioral health services at Mercy Medical Center. Welcome, Doctor, and thanks so much for joining us. I'm glad I got that title right because it's a long one.
Thank you, Jane.
Behavioral sciences, it's really a euphemism for all kinds of behavioral difficulties that affect our mind and our behavior.
Right. Behavioral health care comprises mental health and substance abuse care. And at our center, we treat people who are living in the community, typically after a hospitalization. And mental health care comprises a whole range of disorders, which I know we're going to talk in more depth about.
Well, you were recognized as New York State's first integrated behavioral health care program. What's that mean?
We're very proud of that designation. It means that we added primary health care to our services. That means we have an internist in our building every other week who can assess people for well visits, sick visits, treat their hypertension, their diabetes, their obesity, right in our clinic. We like to think of it as one-stop shopping.
And the concept really is that if you've got something wrong with your head, basically, there might be a lot of physical issues that might be leading to some of that.
Sure. So the mind and body are very well connected and dependent on the functioning of both. So integrated care also means that that practitioner who's treating your physical illness is involved in dialogues regularly with the treatment team that's involved with taking care of your depression or your anxiety or more profound mental illness.
And it's nice to see that you can actually integrate all of that. So really, it's so much more efficient for the patient too.
That's right. The convenience of being able to see someone who attend to your chronic illnesses as well as just a typical cold or flu, it makes it a lot more convenient.
Let's talk about the prevalence of mental illnesses and what kinds are really out there today, because we talk so much more about it, but the reality is, are we seeing more of it or not?
I think that we live in an age where there's more information available. People will look up conditions on WebMD. They'll research conditions. We're certainly identifying more illness in the elementary school now, but the slide you have up shows that the prevalence, perhaps to the surprise of the audience, of major depressive disorder, typically called clinical depression, is almost 15 million people suffer from that. There's also a range of anxiety disorders that are just as common as those. More profound mental illness is also diagnosed under the labels of bipolar disorder, schizophrenia, which is a lower incidence, panic disorder, which is in the class of anxiety disorders, and also the illnesses that affect the elderly of Alzheimer's disease and dementia also come within the scope of behavioral health disorders that we treat at Mercy.
Now, one of the things that you just talked about, you said something about people will be surprised about this depressive disorder or the prevalence of depression. But the reality is, a lot of people may be suffering from a mental illness, but they are in denial about it, and they will not get help.
Like a lot of chronic disease, denial is a major stumbling block. People often kind of white knuckle it through an illness. 1 in 10 people suffers a major depressive disorder every year. but probably less than 10% of those individuals gets any kind of care. So they'll go through sleepless nights, they'll have trouble in their marriage, trouble attending work, absenteeism. They may turn to alcohol or substances to kind of tough it out until they kind of ride out the worst phase of the illness.
But does that mean if you deny it, it's going to get better?
Absolutely not. I mean, these usually are recurrent diseases that may be aggravated by loss or stress. You know, we've lived in stressful times. We went through a very rough economy, so that certainly affects people's well-being. But no, not attending to it, even like a physical illness, is not going to do you any good.
Well, so what are some of the reasons? Is it because it's not going to be covered, or because they don't feel that they really are sick enough, or what are the reasons?
Well, what you're looking at is a slide from 2009, the National Survey on Drug Abuse and Health. And this shows that people either felt that they didn't need care, almost 10% of individuals. They thought that their insurance company didn't cover it. And that's a big misunderstanding these days. There is parity between mental health and physical illness now. So if you have coverage for physical illness within your insurance plan, you have coverage for mental health and substance abuse. We also would like to see, this slide predates the Affordable Care Act, so could not afford cost. We're seeing a lot more people apply for services who have gotten health insurance through the exchanges, so many more people are covered these days.
And that must be something that is very comforting to you.
Yes.
Speaking of the kind of people who actually come in and seek treatment, let's go now take a look at the Mercy Medical Outpatient Behavioral Center that's at Oak Street, and we'll talk a little bit about the unique services that are offered there.
Here at the Outpatient Behavioral Health Services, we do different kind of therapy. In terms of as far as I'm concerned, we do pharmacotherapy, where we use medication to treat patients' most common mental illness here. We also provide other type of therapy in terms of individual psychotherapy. We have a group therapy. We do also what we call cognitive behavioral therapy, where we try to address the patient's problem to see if we can bring out significant change in their behavior and their thinking and the way they feel. What makes our setting special is because we provide all those treatment modalities in one site. So what you would call one-stop shopping. That makes us unique. Actually, we were one of the first sites that was awarded what they call an integrated license project. So where we will be able to provide all the services under one umbrella in one site.
Mercy Medical Center at Oak Street has several components to it. There's the mental health clinic, and there's family counseling service. We work with patients who have substance abuse issues, who have mental health issues, and the great part of it is that they have been very supportive of us having art therapy and an open art studio where any of these patients can come, and it's kind of like a safe haven. It doesn't matter their age, their diagnosis, their IQ. Anybody can come in here and express themselves with art materials. The art therapy can sometimes be intimidating at first for the patient, especially people who haven't done art in a really long time. I would say, though, 95% of the time, a patient will engage in the task after some encouragement. You know, it takes people a little time to adjust to the fact that they're going to be drawing again when they haven't drawn since they've been in, grammar school.
The art therapy, we use it for patients in all the programs. They can come here, and that's a way of them to express themselves, because through drawing, the painting, and so on, and that gives us a chance to really express themselves, and often that the therapist can use that as a tool really to discuss what's going on. And we have also a pet dog here that they like very much, and they interact with.
Glenn is great. Glenn is a service dog and a canine companion. And once a week he comes to Mercy Medical Center and gives a lot of love and comfort to the patients here. Many patients have told me that just his presence in the room has helped them feel more comfortable, less anxious. And there's been many studies done where just being in the presence of an animal can lower your blood pressure. I've seen on many occasions where he's calmed patients down, and also he brings them in the here and now, which is really nice. So he's great at keeping them present.
We integrate a lot of things in our in our services here, anything that can really make a difference in the life of the patient. And they are treated as human beings. As we know, there are a lot of stigma about mental illness, so we need to really give them like a sense of purpose and positive in life and make a difference in their life.
And it looks like that therapy really is doing that, making a difference in their lives.
It certainly is. We have a lot of success stories. The key is to engage patients in a process that'll help them lead to better health, better understanding of their illness, and also to engage their families. I'm very proud of our staff of psychiatrists, nurse practitioners, social workers, licensed mental health counselors, our art therapist, and our therapy dog that makes a difference in helping people feel comfortable getting care for what are very stigmatizing kinds of illnesses.
One of the things that I've been surprised about is the ages at which these illnesses can actually come on. And therapy should maybe begin for a lot of people when they're children.
Right. You know, this slide talks about the age of onset for the predominant illness categories of anxiety disorders. 11 years old is when we begin to first see some of that being pronounced. You know, typically as kids are entering junior high school, it's a time of a lot of change, of turbulence. The protective environment, elementary school is kind of slipping away. But the delay in getting care for anxiety disorders, which are the most predominant kind of illness, is anywhere from 9 to 23 years.
23 years? They start at 11 and they don't get care until they're in their 30s?
You know, if you think about people in your life that have never gotten any care, but they perhaps have avoided things they're afraid of, or they turn to drugs and alcohol, or they've lived very limited kinds of lifestyles where they don't take on risk.
Yeah. Well, you mentioned having the family involved. What about when somebody won't get care and the family sees the issues? Do you ever get involved there? Does a family come to you and say, help us?
You know, it's more common than you'd think. We sometimes will just deal with the parents because they have an adult child at home who's resistant to getting care. What we try to do is give enough education support, help them brainstorm who could get that person to the door of help. Sometimes you have to turn to the authorities if someone's a risk to themselves or others.
But do you feel that we've done a better job of erasing some of the stigma of mental illness so that a place like yours at Mercy, that you can actually have more help in helping people?
I think we're doing everything we can. I think there's also people in the news that have come out and said, you know, I have this illness and I've gotten care. That makes a difference in terms of reducing the stigma of addressing what are really manageable, treatable problems.
Well, thank you very much, Dr. Flummenhaft. We really appreciate you bringing your knowledge here. Stick around because we're going to come back to you at the end of the show. But we're going to take a break first. Our discussion continues with more information about caring and treating mental disorders right after this. Welcome back to CHS Presents Lifestyles at the Heart of Health. Joining me now is Barbara O'Neill, the nurse manager of St. Catherine of Siena Medical Center's Department of Psychiatry. Thank you so much for being here. Appreciate it.
My pleasure. Thank you.
We were just talking about outpatient care. Now you're here to talk about inpatient care when people are actually hospitalized because of some kind of behavioral or mental issues. So when does somebody actually show up in the hospital? How does that work?
Generally, people access inpatient care because their condition is very, very serious at the time. Most often, they come to an emergency room. It could be the one located at St. Catherine's where they would get an extensive evaluation, and the outcome of that evaluation might be that an inpatient stay is necessary. However, there are neighboring hospitals. As Jane, not all hospitals have inpatient psychiatric services, very few actually. So we're often contacted by those facilities to see if a patient that they have can access care at St. Catherine's.
But when you say they've come through the emergency room,
Yes.
is there some kind of immediate trauma associated with that, or is it just it's an odd time of the night and they need immediate help, or what is it?
Well, it means that a person, as in any other medical condition, is in an absolute state of urgency, that their symptoms are such that they really require an urgent evaluation.
So it's not like, does that mean somebody's attempted suicide? Does it
It
mean
could
they've threatened
be.
somebody else?
Yes, it could be all of those things, because unfortunately those things are somewhat commonplace, that people have suicidal thinking in particular, which is, of course, an emergency, and people need to access care right away.
So do you have to be a certain age to go into one of these psychiatric units?
Yes, at St. Catherine's, there are 2 inpatient psychiatric units accommodating up to 42 patients, which regionally is a very large service. We treat people who are 18 years and older.
What about insurance? Does that cover the cost of admission, et cetera?
Yes, of course. Many people do have insurance coverage that does address their mental health care needs. However, we do treat people regardless of their ability to pay for their admission.
Typical length of stay?
About 11 days. Although, of course, that is adjusted based on the patient's needs.
Sure, and how
So there
they're
are some people
progressing
who
and-
stay a lot less, and there are some patients who do stay a lot longer than that.
But you're not really a long-term care institute, so...
No, our categorization is not long-term care or interim care. It's an acute care. So certain guidelines would suggest that we should be treating people under 14 days.
Now, what happens when they're there? Just walk me
Sure.
through the treatment.
Initially, a person has a very extensive assessment and evaluation, and from that evaluation, which the patient takes a lot of participation in, we develop what's called an individualized treatment plan. That plan most often includes medications to assist with symptomatic relief and biochemical stabilization. And then the rest of their hospitalization includes a lot of therapeutic modalities, groups and activities, which really help a person in their journey toward wellness and recovery.
Is isolation something that's a really big part of the ways in which they've gotten to where they are?
Sadly, absolutely. Social isolation resultant from the stigma of mental illness in the community is something that many of our patients suffer from. So during their hospitalization, we also encourage them to avail themselves of some of the community resources and support groups that are in the community for them.
Do they usually do that?
Some do, and unfortunately some do not. It's difficult to engage sometimes in the community, but we do everything we can to get them linked with good support.
So you've got these patients that sometimes they come in through, maybe through an emergency room. They stay with you for 11 to 14 days, and then they go back out. They leave. What happens next to them?
During their hospitalization, from the very beginning, in fact, we start evaluating, and the team begins to brainstorm along with the patient what would be appropriate for them after they leave the hospital, the type of psychiatric follow-up care that they would need, a safe and available place for them to live, other community resources that might help them stay out of the hospital. And also there are a lot of patients who sadly, along with their mental illness, they might have chemical dependency issues. So occasionally we have patients who are referred on, once their mental illness is stabilized, to rehabilitative services in the community for their drug and alcohol problems. Sometimes those are inpatient or outpatient services.
Are families usually involved?
Many of our patients still have families that are really involved in their treatment. Sadly, there are many persons whose families are not involved. It makes it very, very difficult for that person to succeed in the community without that loving support.
Sure. So, I mean, how do they get support? How do they get people to respond to them?
We try to link our patients as best as we can to community resources that truly address that population. There are organizations in the community that offer socialization, that offer other continued groups and things for patients. There are programs that focus on the possibility of gainful employment in the future for them. It's a long process toward recovery.
But they start at your hospital?
They can.
And get on the road, hopefully, to recovery.
Yes, we
That's
do.
what you hope, I'm
a
sure.
lot of what we do is educating the person about their illness and about their wellness, being mindful of that which will keep them well and keep them out of a hospital.
And that's what you hope for every one of them.
I sure do.
All right. Thank you so much, Barbara. Really appreciate it.
It's nice being here.
We have to take another break, but don't go anywhere because there's more of CHS Presents Lifestyles at the Heart of Health right after this. Welcome back to CHS Presents Lifestyles at the Heart of Health. Our final guest today is Margaret Butterworth, a patient from Mercy's Outpatient Behavioral Health Center. Margaret, thank you so much for being here. We really appreciate it.
Thank you.
So you have been a patient at Mercy for quite a long time.
Yes.
What's your original diagnosis and what brought you there in the first place?
Well, my original diagnosis was depression, but that was changed to bipolar disorder and borderline personality disorder. I had a serious relationship that broke up, and I became suicidal, and I was admitted to Mercy Hospital inpatient, and then I started going to their outpatient program when I got out of the hospital.
And that was quite a while ago.
Yes, it was.
You were 28 then.
I was.
And ever since then you've been going, and it is, how has it been for your life?
Oh, it's been a miracle for my life. I have weekly therapy sessions where I can talk about anything that's on my mind. I have monthly medication management from a nurse practitioner who helps me with my medication and my side effects. And I have been in group therapy in the past, and I have been to art therapy in the past where I go weekly and work on my quilting at the Art Therapy Center.
And all of that has helped bring you to a place where you live a pretty normal life.
Yes, it has. I'm able to work part-time and volunteer a few hours a week and enjoy my quilting and my singing and my reading. I have many friends and I really enjoy life.
What would your life be like if you hadn't done that?
I wouldn't be here. I would have ended my life long ago if I didn't have this support in my life right now.
Wow. Well, when you talk about the ways, I mean, there's a lot of people out there who are in denial about where they are. Obviously, you had a very traumatic event that sent you there. What would you say to those people that, you know, haven't had traumatic events but need some help and don't get it? What would you say to them?
Well, that's kind of like why I'm here today. I want people who are struggling to come up for help. I say come up for help because it seems like you're down and that the world is pressing against you. But to come out and to come up and come out for help. It will make a difference in your life, it will make a difference in your relationships, and it will make a big difference all around.
I know that there's been some events for you lately that have been a bit of a struggle. Your parents,
Yes.
both going into a nursing home.
Yes.
And you'd been living with them.
Yes.
And so your home is being sold.
Yes.
And do you think that this help that you're getting has helped you manage that?
Yes, it has. You know, sometimes, you know, we're cleaning out the house and it's very, very difficult because there are a lot of memories and letting go and missing my parents. But in therapy, and I learned to just do 10 minutes a day or 20 minutes a day. Don't have to do hours and hours of work all day, every day. Just take a little at a time or ask your friends or your neighbors for help. And therapy gives me good ideas on how to live life and how to get help.
It's all about being able to cope and manage it in a really effective way and to live a fulfilling life as a result of that.
Yes.
One of the other things that I know you've mentioned about Mercy is that you have an ability to reach someone around the clock.
Yes, there's a number that they offer 24 hours a day, 7 days a week, and you can call that number and leave a message and someone will get back to you just to talk about what's going on and what you might need help with. Sometimes you have a medication that you can take when you're having a hard time and you need to be told that you need to wait 30 minutes or 60 minutes before it'll take effect. But in the meantime, you can talk to somebody, and that can be in the middle of the night or on a weekend when the outpatient clinic is closed, and that's a very helpful service that they offer.
Well, you are, at this point, able to recognize when you need that special, immediate help. I mean, did that take you a while to get there?
It did. It did. I often would have people suggest to me that I needed the help or that I needed to go to the hospital when I didn't think I did. But now I've gotten much more able to identify it in myself. But what I do in order to do that is to call my therapist and leave a message when the clinic is open, so that she'll call me back and I can get the help I need and the advice I need, that if I do need to take extra steps, I can do so.
And I guess, do you feel that there's still a stigma out there in society when we talk about mental illness, when we talk about these kinds of issues? And do you think that that exists, or do you think it's going away?
I think it's getting better, but I definitely think it does exist, because I had to think long and hard about coming on the show, because my stuff would be out there. But and in the beginning, when I first became ill, I wouldn't tell anyone, and I was terribly ashamed and terribly embarrassed. But as time wore on, I got more comfortable with who I am and more accepting of my illness. And if people had a problem with it, then they weren't going to be in my life. And people have become a little more accepting as the word gets out, that we are capable adults wanting to contribute to society.
Sure, a chronic illness. I mean, lots of people have different kinds of chronic illnesses. You can compare it to just about anything else, can't you?
Yes, you can. Yes, you can.
So, words of advice for families out there who might be thinking about somebody getting involved in the program at Mercy, and how it's helped you. Any final thoughts for them?
Well, I think it's particularly hard for people who have a loved one that perhaps doesn't feel that they need or want the help. I think that must be a very difficult situation to be in. And I would encourage them to talk to the family members, to talk to the professionals, to help guide them to get their family member in for help, and to just make the call and have an intake and just feel what it feels like to have someone listen to you. And you'll feel better.
And to feel better?
Yeah.
It's like the whole world has changed for you. Thank you so much for being here. I'm going to invite Barbara and Dr. Flummenhaft to come back out here and join us as we say our goodbyes. Thank you, Margaret, for being so brave as to come here and tell your story, because I know you did a lot of thinking ahead of time, so I really appreciate it.
Thank you.
What do you two say to somebody like Margaret, who's willing to share her story like this?
I'm already standing, but I would give you a standing ovation.
Thank you.
For your bravery, and for I have to say that it's one of the most important voices out there, is the voice of somebody who's received care and has done so beautifully to encourage others to do the same. Thank you.
Thank you.
Thank you, Margaret.
Thank you.
And thank you all for being here. We really appreciate your insights and the work that you do each and every day.
You're welcome.
Appreciate it. And as always, for more information or to schedule an appointment at one of Catholic Health Services' 6 outstanding hospitals, you can call 1-855-CHS-4500 or visit chsli.org. Thanks so much for joining us today. I'm Jane Hanson, wishing you goodbye and good health.